Welcome to the Leukemia and Lymphoma Society of Canada's webcast called Searching for New Meaning and Finding a New Normal. In this presentation, C. Elizabeth Doherty will explore the impact of a cancer diagnosis, both on the individual and family. Additionally, non-medical implications following a diagnosis will be addressed and further highlight the challenges in moving forward and finding a new normal. In the second part, we will hear about the firsthand experience of Aviva Ruben, a cancer survivor, a freelance writer, and patient advocate. My name is Sonia Muto, Community Program Coordinator for the Leukemia and Lymphoma Society of Canada. I will be the host of this online event. During the webcast, you will hear only my voice and the speaker's voice. Since there are many of you, questions may be asked at the end, but only online using the question or chat function. The presentation will last approximately 45 minutes to 1 hour and will be followed by a 15 to 20-minute question period. This presentation is also being recorded. Therefore, you will be able to listen to it again on our website while following along with the PowerPoint presentation. We will send you an email when the recording is available. At the LLSC, our mission is to cure blood cancers and improve the quality of life for patients and their families. We offer guidance and support to people affected by blood cancer every step of the way. We offer a vast array of services and educational resources to help patients and their families. We have several informative tools, such as fact sheets and booklets available on our website, llscanada.org. These tools include guides on treatments, different forms of blood cancer, and psychosocial aspects of blood cancer treatment. We also have multiple educational videos accessible on our website. It is my pleasure to introduce our speaker today, C. Elizabeth Doherty. Elizabeth is a social worker and educator with extensive experience supporting children, youth, and adults facing serious illness, uncertainty, and grief. After specializing in palliative care at the largest cancer treatment center in Canada, she started a community-based practice supporting individuals and families of all ages facing illness, loss, and grief. Elizabeth is honored to be a partner with the Children and Youth Grief Network and an assistant clinical professor with the Department of Family Medicine, Division of Palliative Care at McMaster University. Over to you, Elizabeth.
Thanks so much, Sonia, and thank you to everyone joining us online today. I know we only have a brief while to talk about a tremendous topic, really the idea of searching for meaning and finding a new normal after a diagnosis of blood cancer. Today, I simply want to share the fact that I am only sharing information based upon my work. Now, that's across settings and sectors with people of all ages facing complex illness, trauma, loss, and post-traumatic growth. I also wanted to mention that I would never speak for the experience of another. But as we go forward today, I certainly wanted to state that I am a lifelong learner and might offer more questions than I will answers. Certainly, I believe this is all a process. So let's begin. Again, this is just a brief amount of time together today, but I simply wanted to address some of the following. What does it mean to find a normal or new normal after a diagnosis of blood cancer? And certainly, I wanted to recognize that it is so much more than the physical implications of this diagnosis. So what that means for you as a whole person in terms of the impact and the implications moving forward. I also wanted to note the fact that certainly while someone is treated as a patient in a system, that is so important to access support for yourself as an individual receiving treatment, but also for others around you, the people you love. And lastly, what does moving forward look like in the midst of all of this? So as we begin, finding normal after a diagnosis. Certainly cancer is one word with so much impact, and the word itself describes over 100 types of cancer. And in fact, according to the Canadian Cancer Society in 2019, roughly an estimated 21,000 Canadians were diagnosed with blood cancer. That represents about 10% of all the cancer diagnoses last year. But again, it is one word to describe so many unique outcomes, unique experiences, and certainly for many, though, The word itself is difficult to talk about because the word conjures up so many images, not least of which dying. So how do you move forward when there's one word that holds so much fear and uncertainty? The word itself has so much impact. Certainly, I think, certainly in my work, it's so much about addressing the stigma, because stigma itself certainly really impacts people as they move forward. And it's fair to say that a number of images and experiences come to mind when you think of cancer. Certainly, whether it's worst case scenarios that can indeed create fear and stigma. But it's important to remember that stigma really is referring to stereotyping and biases and beliefs around what that means for an individual. That can also lead to a lot of judgment, and judgment itself can be so harmful for people as they look to move forward and look to heal in the midst of a cancer diagnosis. Being aware of the stigma first and foremost, or the judgment, and certainly can often feel like its own barrier as you indeed look at moving forward in your own experience. Consider what the stigma might be like for you and what it might be like for your family. And how do you respond in the face of stigma? It's really, again, recognizing that it's other people's beliefs or biases or even baggage. So most of which certainly don't speak to your unique experience. And I also wanted to mention as well that this can extend to healthcare providers. Again, that gentle reminder that healthcare providers as human beings have a range of biases, beliefs, and their own baggage, and that some of these conversations prove very difficult for healthcare providers as well. So I think it's an important reminder that communication, although so essential as you move forward following a cancer diagnosis, can indeed be challenging when you look to your healthcare team for directions, for answers, and for support. So it's the recognition that while this isn't true certainly for all healthcare providers, but a reminder that discomfort certainly exists for healthcare providers, and there's certainly stigma that can impact the conversations that people have as they move forward. I simply wanted to mention this stat, normalizing the fact that comfort isn't true for all. And this is actually from a Canadian initiative called the Way Forward. I simply wanted to mention that in case a healthcare provider doesn't bring up a topic or an issue, something that you might want to explore, a question you have or a concern or even a worry, I wanted to highlight that this Canadian study demonstrates that less than 1/4 of Canadian general practitioners and family physicians and nurses are actually experienced and comfortable talking about planning for illness, or moreover, when cancer is already facing so much stigma, let alone end of life, that this carries over to that too. So again, the recognition that you are not alone in addressing the stigma and the discomfort in talking about this. It certainly speaks to the elephant in the room. And I know for many people, it can feel like there's indeed a herd of elephants when it comes to acknowledging cancer, when it comes to acknowledging the treatment, even the side effects of treatment. There can be so much that people know, but they can't speak to, they can't acknowledge. And the other thing I want to mention as well is certainly individuals and families themselves might feel like that elephant in the room after a cancer diagnosis. Certainly the impact as they try to move forward, feeling like they themselves face so much stigma. Indeed, everything feels different. And it certainly feels different the instant you find out about a cancer diagnosis. So how do you move forward, wanting to certainly make informed choices, and certainly considering how you're influenced by the process? What certainly supports your experience and helps you to make those informed decisions? How do you get access to information and resources and support? Trying to make sense of what was normal before and what will normal look like going forward. Trying to figure out what makes sense for you. And again, this will look different for everyone. So while there are many commonalities across a diagnosis of cancer, regardless of type of cancer diagnosis, it's a gentle reminder that the journey is indeed different for everyone. And while you may be regaled with a number of stories about my aunt was diagnosed with this and she did this and this is what her experience was, or my cousin's brother's sister's cousin had this experience and this is how it worked out for them. Again, lots of information to process as you navigate your own experience. The gentle reminder that the journey is indeed different for everyone. What is common is certainly the fact that there is so much uncertainty following a diagnosis. And this itself can be extremely anxiety provoking. So recognizing how you respond to the uncertainty and how you care for yourself in the midst of uncertainty. Recognizing that a cancer diagnosis has impacts across the physical, mental, emotional, spiritual, and practical aspects of your life. So how do you access support from different disciplines and resources to try to respond and answer some of the questions you might have, recognizing as well that some questions certainly can't be answered, but how do we create a space to share what you're wondering about, what you're worried about, and indeed what you're wishing for as you move forward. And certainly it means advocating for care in a time of need, and what that means for you and the people you love as you move forward. Recognizing there's a whole host of disciplines and teams that are available within the healthcare system. But as I already mentioned in the study indicated by the Way Forward initiative, sometimes you're not connected. So again, communication is an important tool, and certainly one as your own advocate as you go forward, which can be difficult to imagine when you're feeling physically and emotionally vulnerable and understandably overwhelmed. How do you ask for what you need? And certainly recognizing we don't know what we don't know, I think it's important to consider what's most supportive for you. And again, there's a range of healthcare providers that can be available to you. Sometimes it's a matter of asking. And this is actually a quote from Dr. Atul Gawande. I'm not sure if folks on the call are familiar with him or not. He is not only a surgeon in the US, but he's a brilliant writer. And certainly his writing focuses specifically on healthcare, specifically on his role in medicine, but the observations he's made over the years in his clinical practice. He speaks about the brilliant advances in medical science, but also the recognition that sometimes science, or moreover, the system, can lose sight of the individual or family, and certainly what that would mean in the impact of a cancer diagnosis. Now, again, it's a gentle reminder that, as Atul says, I think it's a bad sign for us in the medical profession that patients have so much better care when they have the conversation about what the wishes for their care turns out to be. And yet, the majority of the time, the patients have to initiate the conversation. We've got a long way to go. So again, it's a gentle reminder that if you're noticing something or worried about something or wondering about something or wishing for something, and it's not being addressed by your healthcare team and that they haven't initiated the conversation, it's a gentle reminder as your own advocate, how do you initiate those conversations to ask about those things that you're wondering about? Again, we've got a long way to go, and certainly this journey for you will mean using your voice as you go forward to try to bridge the gaps in care that are certainly needing to be addressed for you in your own experience. And this is another quote I wanted to share from a brilliant physician. His name is Dr. B.J. Miller. He has an extraordinary TED Talk. For those that aren't familiar with TED Talks, that's TED Talk. And I encourage you to take a look at BJ. He talks about the fact that quality of life is not a consolation prize. And while many people think about the finish line or living to 99 and that's the goal, what does that mean if we have to relinquish so much about who and what is important to us in the meantime? Quality of life, in my experience, is often only talked about at end of life. And that is a tremendous missed opportunity. I think quality of life is an important consideration for every single one of us here and now, not later. And it is certainly essential for people once the cancer diagnosis has been discussed. And what does that mean for you? What does that mean for your loved ones in terms of quality of life? How do you make space for who and what is important to you, but also how you feel each day going forward? So again, with the range of disciplines that are available within the healthcare system, certainly through the cancer centers, whether that's a registered dietitian or a speech language pathologist, or the range of nurses and nurse educators, certainly connecting with the specialty and physicians that oversee your care, whether it's a social worker, spiritual care provider, respiratory therapist, certainly volunteers are an essential part of this. But I'd be remiss if I didn't mention my own specialty, which, speaking of stigma, is largely misunderstood. And that's actually palliative care. And the reason I mention that is also about bridging the gap in access to care, because palliative care, much like the word cancer, has the connotation only of dying and death. I simply mentioned this as an additional resource because it is often not talked about till end of life, because yes, those were the roots of palliative care when it was first introduced in Canada in the 70s, recognizing that there are physical, emotional, psychological, spiritual, and practical implications for the individual and family at end of life. Palliative care has evolved, however, recognizing that all of those things that impact across the board for individuals and families actually begins at diagnosis. And if we wait to refer someone to palliative care until end of life, there's not only a tremendous missed opportunity, but a tremendous amount of avoidable suffering that could be addressed so much sooner. So I simply mentioned palliative care for this, to demystify what it is, to demystify the fact that palliative care, a palliative approach to care, is available for pain or symptom management for anyone following a diagnosis of cancer. That the emotional, social, spiritual, and practical support is also available for the individual and the family after a diagnosis. So again, this might be something that you might have to demystify or destigmatize for your healthcare team. But please know every cancer center across Canada has a palliative care team, and they are available to consult about how you're feeling and can see you together with your hematology team. So it doesn't mean giving up access to any care. It is about supporting your quality of life as you go forward with your treatment. So I wanted to just quickly demystify that as well, because so much of this is about navigating the healthcare system. And certainly when you're launched into a world where everything is different and it is a rushed, frenetic environment, finding your way, literally and metaphorically, can feel so overwhelming, especially when you are feeling most vulnerable. The question is, what do you need to help navigate the healthcare system? And what would be most helpful for you? With all of this, it begins with your understanding, no one else's. What do you know at this point? What do you want to know? What do you need to know? And how do we fill in the gaps from there? This comes back to what I was discussing earlier. I'm referring to them as the 3 W's, and I think it's a great opportunity to share with your healthcare team, to guide the conversations you have, but certainly with your friends and family too, trying to understand what's important to them. So what I'm talking about is wonder, which explores questions, worry, which explores fears, and wish, which explores hope. So first and foremost, what are you wondering about? Now, this is going to look different across every family, and certainly the important question is, what do you want to know? What do you need to know? And again, that's something that's an important part of the conversation. Now, whether that's about how to access transportation to treatment or getting your kids to school around your treatment protocols, or how to talk to your kids about a diagnosis, whether it's finding access to coverage for medications or a loss of income, how to support yourself through that. It certainly also could be, what's the estimated prognosis? Recognizing as well, I said estimation because it is not an exact science, but it's important to recognize what you specifically are wondering about, and then in turn, connecting with your friends or moreover your family to find out what they are also wondering about, and then navigating the system to get access to that information to inform your decisions and your care plan as you go forward. The next one, exploring worries. What are you worried about? And again, this is an important opportunity to explore any anxiety, stress, or fear that you have about the diagnosis or treatment or moving forward. It is really essential to have these conversations specifically with your healthcare team so you can have the opportunity to explore what's founded or unfounded. And again, some of those worries, what could be offered to support you in addressing those concerns. So an important opportunity. And again, so very common, but the worries are unique to you. How do you have an opportunity to explore that? And lastly, what are you wishing for? This really is getting to hope, and hope is so essential. And I know hope looks different for everybody. Whether you're hoping for, a good day, whether you're hoping for, the opportunity and the energy to get outside and do some of the activities you used to do, whether you're hoping your nausea is under control so you can eat the foods that you really like to eat, whether you're hoping you have, the ability to play sports again right now, or music, or whatever it is that's important to you. Certainly we know many, if not all, hope for a cure. What is it that you're wishing for? And again, that can be something big, that could be something small. And I still remember sharing this with a woman when I asked her, what was she wishing for on a given day when she was in the hospital? And she said, you know, tea is my favorite thing to drink. She said it helps relax me and calm me, but being in the hospital, they have these dreadful plastic mugs and the whole cup of tea just tastes like hot plastic. She said, I just wish I could have a decent teacup. I said, great, thanks for letting me know. Getting her a decent teacup was really easy to do, and it was something little that meant so much. Again, consider, what are you wishing for, and who do you share those wishes with, so we can begin to address your needs and the needs of those around you. Because we know this is so much more than physical. And indeed, while the medical system is brilliant at treating the physical aspects of this illness, it doesn't recognize often that you are so much more than a physical being, and how a cancer diagnosis impacts you, body, mind, and soul. So while a system is brilliant at treating part of your body, how do we address the impact of a cancer diagnosis on you as a whole person, as a human being? And I think there's lots of pressure around what it means to move forward after a cancer diagnosis. One of the most common things I hear from people is the frustration around someone when they hear, you know, you look really good, you must feel good, right? Well, what happens when looking good doesn't equate to feeling good? Certainly doesn't address the mental anguish or the emotional distress that comes with a diagnosis. There can certainly be a lot of inferred pressure and judgment around looking good. And moreover, coming back to the physical, what happens when a scan or your labs are looking good, but you don't feel great, right? So how do we explore what that means? Because this is so much more than physical. And the other common remarks people hear after their diagnosis is, be brave for the people around you. Be brave to make this through, this whole experience, and stay strong. Again, talking about biases and beliefs and judgment. What does this mean for someone newly diagnosed or going through treatment or after treatment? What does it mean to be told, be brave and stay strong? Certainly, what does it infer the alternative is? That you're weak, that you're not brave. Again, a gentle reminder that all of this is bravery. From the time you receive word of a cancer diagnosis, showing up each day, waking up each day, showing up for treatment, waiting for results, the scanxiety, that's scan anxiety, scanxiety that happens as people are waiting to find out what's next. All of that is bravery and strength. And again, I think the most common thing I hear from people is when they sit down and say, I don't want my family to know I'm struggling. I want to be brave for them. I can't cry in front of my family. I have to stay strong for them. That doesn't recognize the real impact of a diagnosis and the emotional and psychological and mental impact that comes with that. And the suffering that can also accompany that as people try to repress or suppress the range of thoughts and emotions that come with this. And without fail, when someone starts to cry in front of me, almost universally, the first thing they say is, I'm sorry. I'm sorry for crying. And they try to shut it down right away. A gentle reminder, crying is not weakness. It is a natural expression of whatever you're feeling. It is not weakness, and it does not mean you're not brave. So again, how do you move forward? Remembering how brave you are and how strong you are. And it does mean acknowledging the range of these responses. And while this slide talks about positive and negative, that's judging all those emotions on the right-hand side of the screen. These are all natural emotions after a cancer diagnosis. And what would it mean to be able to acknowledge them? Especially when so many people say, hey, stay positive. Well, far from everything is positive about cancer, right? So to say stay positive dismisses or minimizes the whole range of emotions and thoughts that come with a cancer diagnosis that are so far from positive. And to not have that part of your experience acknowledged is minimizing and invalidating. So how do you acknowledge what this experience is like? What would it mean to you to have someone acknowledge the experience, acknowledge the range of emotions? and moreover understand, because they have that lived experience too. What would it mean for someone to say, hey, I know what that's like. Me too. I think it's important to recognize as well that there's so much below the surface. Again, coming back to the idea of looking good, there's so much below the surface we can't see. And I actually do a lot of work with kids and teens. This is from a great resource in the States called Art with Heart. And it's really exploring what's below the surface. And again, as you look at this slide, consider what's true for you. And again, this is going to look different for everybody, but there's so many commonalities. But it is recognizing that this experience is traumatic, and that also there are so many losses that come with a diagnosis of cancer. But I'd like to demystify both of those terms before we go forward, or as we go forward. Now, this is from CAMH, the Canadian Association for Mental Health, and I simply wanted to highlight a couple of definitions. The definition of trauma itself, explaining that trauma is the lasting emotional response that often results from living through a distressing event, like a cancer diagnosis and treatment, and that experiencing the traumatic event can harm a person's sense of safety, their sense of self, and their ability to regulate their emotions and moreover navigate relationships. It's also an important reminder that long after the traumatic event occurs, people can feel shame, helpless, powerless, and actually fearful. It's also important to remember that traumatic events can be difficult to define because the same event may be more traumatic for some and not others. So the question is, in your experience, what does trauma mean to you? I also really want to highlight this because, again, talking about stigma and misconceptions and myths, that grief and loss is a big part of a cancer diagnosis, but I want to talk about that. It's an important reminder that grief is simply a reaction to loss. And while we often confuse it as a reaction to death, grief and loss are really just, grief itself is really just a very natural reaction to loss. So again, thinking in the context of cancer, when we lose any significant form of attachment, grief is the process of adjusting. That's from Dr. Kenneth Doka. So what does that mean in the context of cancer? That grief itself, again, as mentioned, is often associated solely with dying and death, but the losses that are unrelated to death are often not even acknowledged. So following a cancer diagnosis, people often grieve multiple losses without acknowledgement that they're actually grieving, and let alone don't actually have access to support around that. Acknowledging a loss is essential before you can begin grieving a loss. It is all a process, but it is also the important recognition that people face isolation in the grieving process. I wanted to mention this because this is one of the most common losses I hear people experience after a diagnosis. That friends and family that they anticipated would be there for them step back or step away altogether. That isolation is so common. And again, whether it's for fear of what to say or how to say it, or not knowing what to say, fear of their own mortality, whatever it might be, it's the recognition that that's a loss and that hurts. It's also the recognition that some people step forward in the most remarkable, magical, compassionate ways as well, when least expected. But I did want to recognize this as a loss and the frustration and anger and sadness that comes with that. I also want to mention something else called secondary losses, which is also important. And the reason I mention this is because many don't realize that this is part of the journey, but they only know that they're feeling anger or shame or resentment or sadness. Secondary losses are related to and following the initial loss. And certainly these can have physical or emotional or mental or spiritual and practical implications. Secondary losses are unique and varied. They can be temporary, like hair loss following chemo, or they could be permanent, like fertility loss for some people. It's important to recognize that a secondary loss, like a ripple flowing outward, that single loss will impact each person in multiple ways. I'd like to ask you to consider what losses you may have experienced in your own journey, whether you yourself have been diagnosed with cancer, or your partner or friend or family member has, or your child. What are some of the primary or secondary losses you've experienced? And again, for some people, that might be mobility during their cancer treatment and as a result of loss of mobility. For adults, that might be not being able to get to work, perhaps a loss of income. And again, that could also be a loss of social connection or activities. It has a ripple effect. So again, considering the primary losses and the secondary losses. And the reason I mention this is many people say, I'm struggling to cope, but I don't understand why. It's first and foremost recognizing the losses you have experienced and then caring for yourself. It's also recognizing that the stages of grief are really a myth. So as you grieve your own losses, again, some temporary, some permanent, this is not a linear or straightforward process. And there will always be triggers and reminders that as long as you have that lasting connection to something you've lost, you will continue to grieve it for the rest of your life in new and different ways. And as you move forward with that loss. But again, a gentle reminder that it is part of the experience. So how do you access support for yourself and for others as you go forward? I think it's an important reminder to consider, what does family mean for you? And I simply ask, what does it mean for you? Because I know I've walked into a room with 14 family members and they couldn't be more disconnected or unsupportive of one another. I've also walked into a room where someone's been sitting beside their neighbor and they are so connected and supported. So what does family mean for you as you go forward? That could be family that you're connected to legally through birth or adoption. It could be found family that you've connected to through community in a number of ways. What does family mean to you? And how has a diagnosis impacted them as well? Healthcare certainly talks a lot about person and family-centered care. And if you feel your family is not receiving the support that they deserve and need, I encourage you to ask your care providers, how does person and family-centered care look in this place? What supports and resources do you have for my family as well as myself? Again, a gentle reminder, if it's not asked or it's not offered to you, a gentle reminder to ask. Because as you already know, the impact goes way beyond the individual who's diagnosed with cancer. And I think this is an important recognition as well, that the most common thing I see, and I keep mentioning a lot of common things, but the most common thing I see within families is that people protect the people they love. And that often means compartmentalizing or suppressing or repressing some of the feelings that come with this, because they don't want to be a burden. They don't want to worry others. This is certainly true within families when there are children involved and young children. And I mean, certainly that's true regardless of the child's age, but specifically with kids and teens. I simply put up this slide as a gentle reminder that people pick up on the verbal and the nonverbal cues that people notice so much, and especially kids and teens who are so intuitive and aware. I gently remind parents that they are picking up on so much more than you even realize. So how do we look to support the entire family going forward, making sure that you all have access to information and resources that speak to your unique needs, recognizing that that support, those coping strategies are going to look different for everyone. And again, the reminder that while commonalities indeed exist across cancer diagnoses and experiences, the reactions to trauma and loss are still going to be unique for each individual, even within a given family. I wanted to mention this, that there, again, this is from Doka and Martin, talking about responses to loss and grief. The reason I mention this is because we metabolize these experiences differently. That there's something called intuitive grieving. And these folks who are intuitive grievers are primarily going to look at emotional or spiritual outlets to process their experience. These are the people that will want to sit down with someone and look them eye to eye and say, I need to talk about this. They integrate and move through their experience, processing the emotions and meaning making and spiritual experiences. They can do that across from one another, looking someone eye to eye, whether that's someone they know or a stranger. But they make meaning of this, connecting with someone through emotional and spiritual outlets, eye to eye. Conversely, and I don't say conversely like there's right or wrong, I often refer to this like being right-handed or left-handed, recognizing, of course, there's a spectrum as well. But instrumental grievers are folks who metabolize these experiences through doing, not being. And instrumental grievers think of an instrument or a tool. They will primarily seek mental or physical outlets to digest and process the experience. They look to connect with someone shoulder to shoulder or back to back. So talk therapy for someone like this is going to feel more like a threat than a complement to what they need. And again, the reason I mention this is in a given couple or family, when someone says, I want to talk to my partner about what this experience is like, and your partner's saying, right, I've got to go out for a run, I can't sit right now. It could be that it's a matter of an intuitive griever versus an instrumental griever or coper. So again, recognizing that instrumental grievers will integrate the experience through thoughts or actions. So recognizing first and foremost, what does it look like for you? Where do you fall on the spectrum? What do you need to support yourself as you go forward? And what about the people around you? What does it look like for them as well? Recognizing that it can create tension when we have different needs. How do we recognize what's unique for each one of us? And then accessing the information, resources, and support to address those needs as we move forward. It's also an important reminder that there's the enduring impact of trauma and loss. And again, a gentle reminder that as people say, I don't feel like myself, or I'm trying to figure out who I am, our sense of self, identity, and the assumptions we hold regarding our place in the world, these are threatened in the face of trauma and loss. And depending on the nature of the trauma or loss, someone's identity can be changed temporarily, like when there's hair loss and all of the things that means for identity around that, or permanently, again, if it comes to fertility and someone is no longer able to have children, and that's certainly something that was important to them. What does it mean as you move forward? I also wanted to mention post-traumatic growth. And again, this is not to say by any means that traumatic events are viewed as desirable or something we wish for. But it's an important reminder that hearing stories of others moving through trauma are important to empower and understand in post-traumatic growth. But that strength, and this is coming back to the whole idea of being brave and staying strong, strength and post-traumatic growth is often correlated almost paradoxically following an increased sense of being vulnerable. Yes, I said being vulnerable. Just I wanted to mention one of my social work superheroes, Dr. Brene Brown. If you're not familiar with her, I encourage you to take a look online because she specializes in research on vulnerability. She's got 2 brilliant, I'm going to say the word again, TED Talks. I encourage you, and if I can assign them as homework, I'd like to do that. Brene talks about the fact that vulnerability is not weakness, and that myth is profoundly dangerous. Vulnerability is the birthplace of innovation, creativity, and change. So what does that mean for you as you go forward in your own experience? And I also wanted to highlight this, David Giuliano, who has been living with advanced cancer for many, many, many years. And after an experience of his cancer being misdiagnosed and then experiencing a range of side effects and symptoms and complications, he writes about finding and using his own vulnerability, and through his own vulnerability, finding healing. David also talks about his own experience and saying there is a difference between healing and cure. You can be healed and not cured, but you can also be cured and not healed. What does that mean for you? And exploring healing, again, considering what it means to be vulnerable. This is from Pema Chodron talking about when things fall apart. Things falling apart is a kind of testing and also a kind of healing. We think that the point is to pass the test or to overcome the problem, but the truth is that things don't really get solved. They come together and they fall apart, then they come together again and fall apart again. It's just like that. The healing comes from letting there be room for all of this to happen, room for grief, for relief, for misery, for joy. So how do you move forward in the midst of all of that? Where next? Indeed, a good question, and certainly as you face vulnerability and uncertainty. I wanted to highlight this quote. This is actually from Van Gogh, an accomplished artist, talking about the fact that I am always doing what I could not do yet in order to learn how to do that. I simply highlight this with the notion of perfection, or the notion and the pressure to do more, to be better. It's simply showing up. All of this is a practice. All of this is recognizing what you need and simply doing the best you can. No more than that. And again, recognizing as well the frustration that comes with that. When you used to do 150% and on a given day, you might feel like you can do 10% of what you used to, your old normal. It's also being gentle and compassionate with yourself around what you're able to do as you navigate finding that normal again. A big part of this is acknowledging boundaries. And certainly those boundaries, if you think about it, boundaries are there for safety. Why are boundaries important to you as you go forward, considering physical, emotional, mental, practical, spiritual limitations? And I say limitations in the sense that you can only give so much. So what do you give of yourself and what do you allow from others? Coming back to healthy boundaries, also known as self-care. Sometimes saying no to someone else can actually mean saying yes to yourself. So how do you establish boundaries that promote your healing. It indeed recognizes acknowledging the uncertainty, and this can be really difficult for people who are self-professed organizers and planners when so much of that control is taken away from you. So how do you first and foremost acknowledge that uncertainty is part of this journey? And then how do you find certainty within the midst of that uncertainty? Sometimes it's simply connecting with the breath in a given moment and connecting to that present moment in a mindful way, knowing that we are hardwired for fight or flight simply through using our breath, connecting with our breath. We can shift to a rest and digest. So what do you need to make that shift? This is actually from a resource on Instagram. And yes, social media can indeed be a supportive force for this experience. Talking about anxiety grounding techniques, connecting with your breath and finding ways to support and ground yourself in a sense of anxiety when you're facing a sense of anxiety or overwhelm or uncertainty. Coming back to the present moment. Again, recognizing as well, despite the feeling of isolation, certainly feeling alone, how do you explore what you need to care for yourself and care for your family? Certainly it is about finding community, and community is indeed a group of people living in the same place, but moreover, having a particular characteristic or experience in common. That feeling of fellowship with others as a result of sharing attitudes, interests, goals, that is power. And that can be so helpful in healing. I wanted to simply share a couple cancer connections through the Canadian Cancer Society. The Cancer Society itself has so much information, credible information online if you want to learn more about the cancer diagnosis or treatment, but there's also an incredibly supportive community, whether that's for someone who's been diagnosed or support for a loved one. You can connect with someone else who's been there. I encourage you to take a look online to learn more. And certainly, as Sonia's already said at the outset, the Leukemia and Lymphoma Society of Canada has a range of resources and supports available for you. Again, these are available for free. A gentle reminder when you feel you're most weak, certainly weakest or most vulnerable, reflect on your strengths, because it is so easy to lose sight of that. Sometimes it's a recognition of letting go and certainly recognizing as well, we cannot predict the future. So how do we recognize what lies behind us and what lies before us, or small matters compared to what lies within us? Reflecting on your strength. And some of you may know this is the Serenity Prayer, which it is indeed. A gentle reminder exploring what you can control. And I've said here, insert your relevant higher power, whether you are religious or spiritual, but really the recognition of granting me the serenity to accept the things I cannot change, courage to change the things I can, and the wisdom to know the difference. I think indeed when your health or well-being is threatened, it comes back to recognizing those small things are no longer small things. I ask that you consider what gives your life meaning, who and what gives your life meaning. And that sense of gratitude, certainly recognizing whether that's the ability to walk or hug the people you love or eat your favorite meal or recognize the sunrise or the sunset or really truly hear the laughter of someone you love. Listening to good music, whatever it is that gives your life meaning, how do you find moments each day to honor that and experience that? All that to say that this is a very short time to talk about a tremendous experience. And I want to recognize, this is from Dr. Rachel Ruben, who is a phenomenal healer. She talks about the fact that the most important questions don't seem to have ready answers, but the questions themselves have a healing power when they're shared. An answer is an invitation to stop thinking about something, to stop wondering. And life, as we know, has no such stopping places. Life is a process whose every event is connected to the moment that just went by. An unanswered question is a fine traveling companion. It sharpens your eye for the road. So certainly, as mentioned, there are more questions than answers in this experience, and we will have an opportunity after Aviva shares her experience to talk about some questions together. As I already mentioned, social media is a brilliant community to share and connect, and I wanted to mention the fact that I use my social media solely to share resources and support and information. So if you want to connect at any point, I welcome the opportunity. So that's everything for me. Thanks, everybody.
Thank you so much, Elizabeth. Such amazing insight. Very much appreciated. I would now like to introduce to you Aviva Ruben. So Aviva is a Toronto-based freelance writer of essay, memoir, social commentary, and fiction. She's a cancer survivor, single mom of 2 boys, and patient advocate. Her writing explores the intersections where trauma, pain, and anxiety collide unexpectedly, creating joy, hilarity, possibility, and connection. The resulting shared human experience is where she believes hope lies. Her writing has been published in the Globe and Mail, the New York Times, the Toronto Star, Chatelaine, Toronto Life, and a number of anthologies. She is also the author of the memoir Lost and Found in Lymphoma Land that documents her harrowing, hilarious, boring, and scaring trip into the world of cancer. Over to you, Aviva.
Thanks very much. Can you hear me?
Absolutely.
Okay, great. First of all, I wanted to say thank you for inviting me to talk. I'm thrilled to be here. And Elizabeth, that was a great presentation. So many important topics and issues like communication and the demystification of palliative care and navigation and the quality of life. So also important. And I'll be talking about a lot of those things, but just from a different perspective. So now you're going to get the patient perspective on searching for meaning post-treatment, or I should say a patient perspective, because I'm only one person. And as Elizabeth mentioned, everybody's experience is unique and different. But what we're talking about here is the so now we're done part of cancer, the yay, life is back to normal part. But we all know there's no actual going back, there's only going forward into something new. And as for being done, well, no matter what cancer you have or had, how cured or in remission you are, I think that most of us would agree that the word done is not quite the right word. If we're lucky, we get to be done-ish. There are lots of helpful things to do, but there's no actual right way to do it or right set of things to feel. So I'm going to talk about the feelings part, my feelings about the cancer hangover. And what's true is that sometimes the emotional and psychological pieces don't get into remission as easily as the biomedical stuff does. So a bit of background, I crash landed in what I call lymphoma land just over 6 years ago. I've been a full citizen for quite some time. Before I even knew what kind of lymphoma I had, people told me I was lucky, that I had a good cancer. Of course, they had no idea what they were talking about. There are actually 82 or maybe more different types of lymphoma. They're not all good cancer, and what's good cancer anyway? I have marginal zone lymphoma. It's small cell, which is a plus because it's more chronic than deadly, but it can't be cured. It'll be back. Sometimes when I say that, people tell me I've got a bad attitude, that I should be more positive. Really? Like being more positive will keep it at bay? I now get to call myself a survivor. I didn't do anything to earn the title except make it this far. And it's not because, as Elizabeth talked about, I'm strong or brave. It really irritates me when people say that mental or physical strength is key to surviving. Surviving isn't a question of muscle mass or positive outlook. Not that those things don't help. They can certainly make the day-to-day a bit less icky. But you're not going to die of cancer because you're cranky, and you don't survive because you're upbeat or great at push-ups. But once you've been welcomed onto the survivorship, sorting out how to float this boat can be a lonely and challenging preoccupation. Most people don't understand the now what dilemma that comes post-treatment. They're like, okay, off you go, back to your life. Once the 6 months of active treatment and the 2 years of maintenance chemo were over, a new pressure kicked in. People expected me to get my act together or rejoice. After all, I'm here, right? They want it to be over for me for all sorts of complicated reasons that range from my well-being to their needs and fears. And of course, I project my own expectations of what my life should now be onto them. The good news of remission came with a flood of gratitude and appreciation for life. I expected that flood to last longer and maybe overhaul certain irritable, ungrateful aspects of my personality. But it turns out that it was more of a tide than a flood. In it came, out it went, and I'm like, wait, I'm supposed to be a better person. I do find it a little curious that those of us who went to cancer hell and back are expected to feel more gratitude than the average human. The celebration, the optimism, they don't actually come easy. I should be more positive. I should seize the moment because who knows? But everybody's different. Some of us get mostly back to our old lives with ease and grace. Some of us don't. But we all move forward with our suitcase, our backpack, our Prada purse or no frills plastic bag, now filled with things like chemo brain, peripheral neuropathy, no boobs, financial pressures, resentful kids, fear of recurrence, sexual dysfunction, return to work anxiety. Even if we're told we're cured, the fears, anxieties, and cancer leftovers can linger, and that makes perfect sense. The radiation oncologist recommended that I radiate the areas where the tumors were. Mine were in odd places. One was in the wall of my vagina, and the other was in my face. I'm told this kind of lymphoma can come back anywhere, but it's statistically more likely that it'll come back in the same places. The doctor described the pain, permanent hair loss, and sexual impediments I'd be likely left with, and refused to discuss the option of not doing it. I radiate, she said. Ask your oncologist about not doing it. So I went to Princess Margaret and got a second opinion. I would never have questioned anything in the early days. As time went on, I got bolder. It's always worth asking. After the PET scan didn't light up with cancer bits, doctor's second opinion and the tumor board at Princess Margaret told me I could opt out of radiation. It was both super exciting and totally scary. It's hard not to feel you shouldn't throw everything they've got at the cancer just in case. But he told me my oncologist would likely do a CT every 6 months to check that nothing nasty was growing back. When I asked her about this, she said she doesn't like to scan that often, too much radiation. Unless I was showing symptoms, she'd do it at the end of my 2 years of maintenance chemo. So after months of constant data, I'd now have none for 2 years. I'd be out there on my own with only quarterly doses of medication and my imagination to fabric health stats. Unfortunately for me, left to its own devices, my imagination tends to feed my fears rather than calm my nerves. I think that might be true for a lot of people. From the outside, I look like my normal self. It was time for cancer to step away, but it wouldn't leave the building. It hung around begging me to play mind games. Sometimes it still steers me into a paneled den to do my feared jigsaw puzzles. The pieces keep changing. Was that twinge in my lower abdomen ovarian cancer? That ache in my breast cancer? That pain under my eyebrow a new lymphoma tumor? Are these reasonable fears? Nothing's reasonable. Cancer spits on reason. And anyway, me and reason, we've never been that tight. And while having another kind of cancer on top of the lymphoma may be as likely as hitting a moose in downtown Toronto, it's not impossible. Best to be ready. Cancer sucks the air out of a room. It perches on top of family dinners and casts its shadow without warning. It's tiring to fend it off and out of the question not to. Sometimes it needs to be outrun. Sometimes it needs to be bashed over the head with a baseball bat. Sometimes it needs to be sung to sleep with a lullaby and some Ativan. It probably looks like a fly swatter ought to keep it at bay by now, like I could opt out of the games if I really wanted to. You're done, right? The cancer's in remission, right? You're feeling good, right? Don't worry so much. You look great. Get on with your life. Don't even get me started on you look great. Elizabeth mentioned that too. When I'm not reacting to cancer's provocations, I'm trying to sort out life's big questions about balance, happiness, calm, fun, health, love. In the meantime, the little questions like, where are all my tax receipts, go unanswered. Meditation seemed key. I took a mindfulness course, made a commitment, worked up to 25 minutes a day, and I thought I'd never stop until I did. Now getting it back on my schedule seems near impossible. But I do believe it's a good thing to do. Although sometimes when people say, you should meditate and be more positive, what they're actually saying is, please don't talk about that icky stuff so much. And sometimes we just need to. Cancer may have taken away some of my control, the control I had over my life, but mostly it peed all over my illusion that I had that much in the first place, that any of us do. All we can control is our actions and reactions, not what befalls us. I was healthy, I ate well and exercised, but cancer happened. It happens all the time. It intimidates, it bullies, and tells me where to go. Now I need to start doing the same back. Listen, cancer, you asshole, you don't get to ruin everything. That's a start at control. It's hard for people to understand how the disease eats away at confidence and joy and hope, how it cuts off your bootstraps, making it hard to pull yourself up. I don't know what bootstraps are, but people who have them tell people who don't to pull themselves up all the time. Don't worry about it. Get on with your life. This is what getting on with my life looks like. Step in, step back, step in again, spin around, shake. Life with lymphoma, or the specter of lymphoma, looks a lot like the hokey pokey. I lost and found many things throughout this trip. Some things are on both the lost and found lists. I lost weight, I found weight. I lost hope, I found hope. I found fear, then I lost it, then I found it again. Then it hid under my couch and jumped out at me. I found patience, then I lost it. I lost vanity. Just kidding, I never lost that. But I did lose 3 pairs of Ray-Ban sunglasses. Sadly, I didn't find any. I found many, many cancer pals and dear friends who understand what I've been through and can laugh at the things other people think are really not funny. I guess it's one of those you had to be there situations. The other thing I found, or maybe it found me, was the ability to be there for others through the really hard parts without letting my own fears shut me down. I learned how to listen to a friend or a near stranger say, I don't know if I can do this anymore, without responding, of course you can, you're strong, don't ever say that. I consider this newfound skill to be a gift. Kind of what Elizabeth was talking about when she talked about post-traumatic growth. I was at Druxy's at the Odette Cancer Center one day last year, and an older couple was looking for a place to sit. The wife was pushing her husband in a wheelchair. I gestured for them to join me. He looked so dejected. She fussed over him a bit, and then before heading off to get him some soup, she said, you have to be more positive, Luigi. We started talking. Luigi also had lymphoma, but a way worse kind than mine. He'd just been given a bad prognosis. He told me he was so tired that he wasn't afraid of dying or even being sick. He was worried for his wife and daughter, how they would manage it all. We only had about 10 minutes to talk, but I could tell that our conversation brought him relief. He needed to talk about the awful parts. I don't blame his wife. She was doing her best, but telling him to be positive was basically telling him she couldn't deal, and he knew it. Time heals, not everything, not cancer, but the sense of isolation and unfamiliarity that came along with it. It's easier now, even if the mention of the disease, and boy, does it ever get mentioned a lot, people getting it, people dying of it, running races for it, wearing ribbons, buying lottery tickets so they can maybe win a house for it. Those things are still a personal affront. It doesn't matter what kind of cancer or who gets it. It's always a little about me. When I hear that someone I know or don't know has died, I listen for the cause and feel a messed up kind of relief when it's a heart attack or an accident and not cancer. Last week's news of the all too speedy deaths of journalists Ann Kingston and Christy Blatchford, both in their 60s, was a horrible blow. There's no right way to do cancer or its aftermath, what gets called survivorship. I chose to lean in. I wrote and talked a lot about my experience. I got involved on the Patient and Family Advisory Committee at the Odette Cancer Center. I made a lot of friends with many different kinds of cancer. Some people wanted and needed to talk about it often, while some, like my dear friend Ben, who died just over 4 years ago of colon cancer, kept on as though nothing had changed. He continued work on his PhD, his TA gig, and he ran his business. He had no interest in talking about what was happening cancer-wise, or very rarely, mostly because he didn't want to deal with people's awkward sympathy and suggestions. After surgery, his brother brought him a book about eating to cure cancer. Once his brother had left the hospital room, Ben handed his wife the book and said, throw this in the garbage, I never want to see it again. People mean well, but getting it right isn't easy. And as Elizabeth mentioned, you never know who'll show up and who won't or can't. I had one close friend who pretty much disappeared. We were barely in contact. She didn't live in the same city as I did, so that made it a bit less awkward. 4 years after I'd finished treatment, we finally talked about it. Until then, I'd just kind of pretended nothing had happened. And then she was in my kitchen crying. She hugged me and told me how desperately sorry she was. Sorry that she hadn't been there. There I am saying sorry. I think exactly what Elizabeth said, and that's such an interesting observation. She just couldn't handle it. I understand that now, even though I didn't at the time. Sometimes we're told that everything happens for a reason. I hate that saying, but I do believe that almost everything that happens brings its own reason, its own new purpose, motivation, or end, unexpected gifts and connections. Sometimes it does depend on how we choose to look at it. Sometimes I feel cranky and exasperated, but now and again, and hopefully more and more often, I get it right. It can be a shared smile or a funny moment with a stranger in the MRI suite, or a conversation with a man at Drexy's. The best of life can come when our paths cross in hard, weird, or hilarious places, and we allow ourselves to be really seen and allow others to see what we see. It's what Brené Brown calls vulnerability. And sometimes being supportive is not what we think it should be. We might believe that when a friend is ill or going through a difficult time, the best thing we can do is spare them our own problems, but often the opposite is very true. Asking for advice makes others feel useful, normal, alive. There's no such thing as certainty. Cancer taught me that. But there's one thing that is certain. I can't ever not have had cancer again. So what's left for me now is making the choice to move forward each day, to forgive my anxieties, to laugh at myself often, to connect with people who understand, and to minimize my fears and maximize my hopes again and again. Thank you.
Thank you so much, Aviva, and thank you very much, Elizabeth, as well. This is such an important topic, and we are just beyond honored to have you both here to share your experiences and knowledge with us. Very much appreciated. We will now take some general questions. So please remember to use the questions or chat functions, and I will go ahead and read those questions out. Okay, so I have quite a few questions that have come in already. So I will start with the first one is, how can patients feel more comfortable calling their nurse practitioner with random questions? Often when I call, the receptionist wants to know why I'm calling, and I just like to talk directly and privately with the nurse. Is this a communication and accessibility issue? What are your thoughts?
Aviva, I'm wondering if you could share that from your perspective, please.
Yeah, I mean, I mean, the first thing that strikes me, I mean, it just makes me feel sad, because it makes me feel sad that we actually have to ask about how can I feel more comfortable to ask for something that we actually are entitled to ask for. I know that they've done a lot of work at the Odette Cancer Center around having a line that you can call and speak to a nurse immediately, because often what will happen is you'll call and leave a message, and oh, someone will get back to you within 12 hours or 24 hours, and that's just not good enough. And I think that being able to feel okay to push back a little when somebody says, well, what do you want to talk to them about, to be able to say, like, actually, I just really need to talk, and it's very important that you can make that happen for me. So I mean, I know that that's not a perfect answer, but I think that at least feeling that sense that we are entitled to have those conversations, and that the places where we are getting treated should be looking more closely at how they can make that happen, because it's so important. And having to wait hours and hours or sit by your phone for the response that might come is not okay.
Thank you, Aviva. I have another question here is, how do we communicate these feelings to those around us, sometimes very close to us? Communicating without getting frustrated. The physical weakness leads to weakness in articulating. What are your thoughts?
Mm-hmm. So I tried to highlight that a little bit, and again, recognizing that it is so uniquely different for each individual or family. And I appreciate you gently, kindly acknowledging that, Aviva, as you started to tear up, recognizing the range of emotional responses we all have. But then almost immediately followed by the, I'm not sure how to share this, or moreover, more often, I'm sorry, I'm just worried about being vulnerable. again, that's not weakness, but how we open up to others around us is going to look different for everybody. But I think coming back to even exploring those few things, wonder, worry, and wish, can really create very open-ended discussions, conversations about what people are wondering about, the questions they have, right? Even within a given family. Again, an opportunity to clarify some of those pieces, or questions we, need answers for, or at least, want to explore further. Who should we connect with to address those questions? But then also recognizing the emotional impact of this, right? The worries. What does this mean for you? What do you like? Again, exploring fears. I think how we can create and name that in a space where it's open for the people around us certainly gives permission. And I know it seems silly to say gives you permission to share those fears, but again, when people keep that and isolate themselves, quite often I hear families are experiencing the same thing around fear and sadness, but they just don't want to share it with the people around them. Sharing that can be remarkably powerful, especially and even in the midst of vulnerability. And I think that's when that comes to exploring wish or hope, right? So what does each person in a given family wish or hope for? And again, some of those things may be the same, some of them different, some of them big, some of them small. But I think it's how we just as a human experience unapologetically, and I know that's a big shift for many people, that being vulnerable means actually being truly authentic about yourself, about what you're wondering and worried about. And to be able to open those spaces up to others actually means a deeper, more honest connection. So I encourage those conversations, recognizing they're not easy by any means, but it's important.
Can I just jump in and add one thing to that? And I was talking about this, it's our need to talk about the hard parts. And when you're talking about your distress or your worries and your fears, it doesn't actually mean that you're giving up, you're giving up on life or you're being negative. It just means that you have to get them out. And sometimes clarifying that before you even start a conversation with somebody that you're very close with is important, because I think that gets read as negativity and and a sort of a sense of giving up. And that was exactly what happened, the conversation that Luigi had with his wife, where she's like, you've got to be positive. So.
Thanks, Aviva.
Thank you. Thank you both. I have another question here is, 1 year ago today, I was diagnosed with multiple myeloma, and it's been an ugly journey at times. What practical daily activities, disciplines, or habits have helped you or the people you know?
Aviva, do you mind speaking to that?
Yeah. First of all, I'm so sorry. I just hate that everywhere I turn, somebody is, joining this cancer club that nobody should belong to. I think, and I know multiple myeloma a little bit because my first cousin was diagnosed with that a couple of months after I was, and I think partly, and I can't speak to the sort of practical physical things that you can do, like, because that's really up to, what it is that you're able to do in terms of, whether you go out for a walk or try to meet up with people. And I know that for the first few months, for my cousin, it took a long period of time to come back to some kind of feelings of optimism. Like because the fear is so overwhelming at the beginning. And for me, I know that I felt like I lived kind of in a cancer bubble that I could never get out of, but other people could step in sometimes and be in it with me, but then they could step out and talk about some, I don't know, going out for dinner with some friends or doing something, and I couldn't get out of the bubble. I was stuck in there. And it did take, it takes years in some ways. Like, I'm 6 years out and I still have some of these fears and anxieties. So I don't, being able to have conversations with people who've gone through either what you're going through or things that are very similar feels to me really, really, like, it's been hugely important for me. My connections to people, and they didn't have to have had lymphoma. They can actually have had all sorts of different kinds of cancer. And sometimes they're the only people that really understand what it is that I'm going through. So I suggest that as one of the things that really worked for me, is finding somebody to talk to. That's kind of, I guess, what I would, because I don't have a lot of otherwise practical suggestions of, what to actually be doing when you get up each day, but talking it through is so important.
Thanks, Aviva. And I simply wanted to add to that as well, that I think the irony in all of this is that when you're facing medical science and prescriptive approaches and evidence-based understandings of what this all means, that caring for yourself as you move forward is really not prescriptive, that it looks so unique for each person, and that the challenges that you face, and certainly the sense of defeat and overwhelm and fear and anxiety, although common for many, many people, will still look uniquely different, as will a given interest that you might have before the diagnosis. So what that looks like as you move forward, what inspires you or motivates you or encourages you, instills that sense of hope again, bit by bit, breath by breath, step by step. It's going to look uniquely different for everyone. And I think sometimes people will often, without realizing, compare themselves. Well, so-and-so is doing this as part of their healing journey, so I need to do that too. And again, I think it comes back to recognizing what speaks to you uniquely in terms of supporting you without creating additional judgment or strain, but moreover supports you in the process, coming back to who and what matters most to you, and bit by bit making room for that. And again, if you need additional support, certainly whether it's from a medical perspective, again, advocating, reaching out for the team if it's a matter of mobility or something, whether it's occupational therapy or physiotherapy. But I think first and foremost, connecting with someone else, as Aviva's already said, who knows what the experience is like and can normalize that range of thoughts and feelings and frustrations and sadness and anxieties that come with it, to support you and validate that experience as you begin to continue to move forward.
Thank you both. How do I explain my pain and fatigue to my teenagers without worrying them? I look the same, so they still expect me to run as I did prior to my diagnosis.
As somebody who had to explain that to both of my teenagers, I so understand, and it's I don't even know. It's hard to know exactly what to say, because you really do have to find that balance. And there were a few faux pas along the way, like a couple of times where I actually didn't mean to, but I kind of pulled the cancer card on my kids. Once my son, who at the time was 12 or 13, and he was going out. It was winter and it was freezing out and it was snowy, and he's wearing his running shoes, which are basically like sieves. And I said to him, please put on your boots. And he was like, I don't want to put on my boots. I'm just wearing my shoes. So it went back and forth like this. And finally I said to him, if you get sick, I'll get sick. And right now I'm getting chemo, and and then I was so upset at him for not just sort of thinking about me in the situation. And then I was so upset at myself for having actually said that to him and make him feel remotely guilty. I tried to balance out all the things that I could say that were positive about what was going on with my treatment and prognosis and that sort of thing, with the fact that there's going to be this pain, there's going to be this exhaustion, and that's just sort of a normal part of the treatment. But it's hard, and I think the fact is that whether you are telling them these things or not telling these things, they are worrying, and I think Elizabeth talked about that. So they are way more tuned in and connected. And my younger one, who was only 9 at the time, slept with me he hadn't slept with me in ever practically, and he slept with me every day for months, and he would say to me, I don't know what I would do if I didn't have you. And so I knew he was going through that regardless of whether I was talking to him about what I was feeling at any given moment during treatment. So I the best that we can do is try to reassure them and be there.
Thank you, Aviva. And I think it comes back to that whole, I don't want to say notion, because I know it's more than a notion, of when someone is looking good, the expectation that they're feeling good, or I'm air quoting here, but you can't see it, back to normal, right? As Aviva's already talked about in her own experience. So I think while of the biggest roles people take on after a diagnosis is not only how they advocate for access to care and support and resources, but how they have to continually educate those around them. And some of those conversations you may choose to have, and some of them you may not, but especially when it's people you love, specifically within your family, specifically your kids, right? How you have to gently give opportunities to educate or have those conversations around, this might be what you're seeing. These are the parts that you might not be able to see, but are part of this process as I go forward, part of this process as I heal through treatment or after treatment. So again, the things that you can't see, what does that mean for you? What do others notice and not notice? So it's, again, part of that experience is again, educating others. And like I said before with the serenity prayer, some of those conversations you will want to choose to have with the people that you're truly connected to, and others you might choose to just think, I'm tired of trying to educate people who aren't open or willing to see or hear my experience. So, but again, coming back to kids, certainly that education is really so important, but once more, it puts the burden on you to initiate that conversation and have that space to talk about it.
Thank you. Thank you very much. I have a few more questions. So my husband's lymphoma just returned after 12 years remission. He doesn't want to talk about how he feels about this return. How or what can I do to help him deal with the return?
I tried to highlight that a little bit when I was talking about intuitive versus instrumental coping strategies. And I think the system itself is kind of hardwired to say, like, let's get into talk therapy or let's talk about this. And what I was trying to highlight through instrumental and intuitive approaches is that we are, as a gentle reminder, all hardwired differently. And especially facing a health crisis, a crisis of any kind, when we're looking for support, especially for those of us, might not surprise you to know that I'm a talker, I would look to connect with someone eye to eye and talk about the experience and process it. The big part of this journey and the challenge and the tensions and the conflicts that can happen is when someone in your life is experiencing something that is challenging and is a crisis and is life-changing. And you might want to talk because you are the sort of person who intuitively wants to connect eye to eye. The person you might want to connect with might have that instrumental approach to processing and metabolizing the experience, meaning they can't look you eye to eye to talk about it, and instead they might go do something. And it could be doing anything mentally or physically, but simply being eye to eye with someone to talk about the experience kind of feels like writing with your non-dominant hand. It's just not complementing who they are. So I think it's the recognition of noticing first and foremost what it means for you, what it means for your partner, and exploring support for both of you in a way that makes sense for each of you, recognizing there will be similarities, but there are indeed many differences. So what that support looks like will also look different. So that would be my comment on that, is that's one of the most common things I see in families. Aviva, did you want to share around that?
I mean, I completely agree with what you just said. And I think, I guess the only thing I would think that you could do is to ask, what he needs. Like, what do you think would be helpful for me? And I think it's so complicated. And I think we don't talk about caregivers and family nearly enough, because it is the massive impact of cancer on the people around you and the people who are caring for you is so great. And your need to talk is in many ways as important as his need. Well, it is totally as important as his need to not talk. So that means that you need to find those people or supports that that will answer your need to go through this, because now you're going through it. He's not going through this alone. You're going through it together. And the fact that there's a conflict between what makes him feel okay about it and what makes you feel okay about it is so complicated. So, but I think that the one thing is to always know as the caregiver that your feelings through it and your need to talk is legitimate. And maybe it's having that conversation together too, which is like, I know you don't want to talk about this, but somehow we have to find a balance, between not talking and talking, I guess.
And I think as well, coming back to those conversation starters that I mentioned, exploring what you're wondering about, even in relation to your partner's diagnosis, wondering how he's feeling, wondering what he needs. Also sharing what you're worried about as well. And then certainly what you wish for him, right? For you as a couple, as a family. If anything, certainly as Aviva said, right? And I specifically tried not to put any sense of ownership, whether it was the individual diagnosed or the family, because I know this impacts you all. But trying to create opportunities to explore, at least to share your perspective, and that may create an opening for him to share, however brief, recognizing as well that people communicate in a given way, and sometimes that changes and sometimes that doesn't. So again, that gentle reminder to simply do the best you can, be as honest as you can, and again, exploring what you might be able to do to support him at the same time as finding methods and ways and opportunities and resources to support yourself.
Thank you very much. There's actually another question here from a caregiver perspective, which I think would probably be answered by some of what you said, but in case you'd like to elaborate a little bit more, the question is, what is the best way to address a family member's living situation to help them with their care without making them feel like they're being judged or that more control is being taken for them? For example, an elderly, unhealthy parent who is going through treatment, but who needs the extra help and is living alone.
For me personally, I often try to rephrase things, the observations I make, in the form of a question. And I think all of this is not coming forward with my own biases or perspectives, but simply, sharing things that I notice. So if it's, noticing something like, I know your independence is really important to you, or I notice that this has changed for you, or I'm worried about, what this might mean for you. I want to support you as best I can in a way that makes sense for you, that supports you. So I think trying to find the things that you're noticing, that you're wondering about, again, framing it based on the person's strengths, based on the things you know about them, and not a matter of taking away, but more adding to or complementing or supporting them in a way that makes sense for them. I think, Aviva's already talked about the fact that she is now a patient advocate, because certainly there are so many ways, whether patient or caregiver, and I try not to even use the word patient because I feel like that's a whole other loss of identity, but whether the individual or family member is facing the cancer diagnosis, how you can find ways to express your voice, what you're noticing, and, really create an opening, a conversation around that, not from a place of judgment, which I'm sure that's not what you're saying at all, but more from a place of non-judgment, the things you're wondering about. I think the biggest thing is, like I said, people don't want to be a burden, and then they worry about, how they might have those conversations. I think one of my favorite graphics is, especially when it comes to conversations, it's a lot of people have a comfort zone and maybe things that they're familiar with and not quite sure how to step outside of that. And I think simply acknowledging that some of these conversations are not easy, but trying bit by bit, step by step, to really, move forward into those spaces and conversations with people we love, which again comes back to vulnerability, which we've already spoken about today. But really, putting yourself in a vulnerable position to open up to someone else to explore some of this can actually lead to a deeper connection, possibly. Again, I know every relationship is different. But I would encourage you to explore that a little further.
I would add to that. When it comes to what's the best way to help, I think don't ask people to let you know what they need. And that's just a very generalized thing, and everybody's going to be different in terms of how they accept help. But kind of the best thing to do is, like, I have 4 hours free on Monday. I'm coming to do laundry and do, and bring a meal. And, you don't have to entertain me or anything, but that's what I'm going to do. Because I found that, like, a lot of people want to help, and then they say, well, you'll let me know what you need. And then I wouldn't ever ask, because I'm like, I'm not going to then ask them, because that question of being a burden, and then, we're always feeling that. So when people would say to me, I'm just doing this thing, it would be like, great, they've already made the decision, they've set aside the time. And so I guess I would recommend that is just say what you want to do or willing to do. And that you're happy to do it.
Thank you, Viva. I actually agree a lot with that. Absolutely. This is the absolute last question. So recently, someone who has never had cancer told me that I need to be more grateful. What is the recommended response?
I was trying to suppress my laughter there. Aviva, I heard you gasp.
But yeah, I did gasp. I've been thinking so much about this stuff lately, because I mean, the concept of gratitude is a lovely concept, but do not tell, first of all, don't tell other people to be positive, don't tell them to be strong, and don't tell them to be grateful. Like, I'm just like, I don't even know, you know, I guess it really depends on what your relationship is with that person, whether or not you want to take it on, or whether you want to take it on at a later date and say, you know, when you said be more grateful, like I'm horrified that people say these things. Like, it's from such a place of ignorance. And it's like, yes, we can all look at our own lives. And I know that for myself. Like, I look at all the things that are good, and then I'm like, well, why are you worrying about the cancer coming back or this or that? You've got so many. It's like, we can do that for ourselves if we want to, but other people cannot tell us to be more grateful. So I just like that totally, that irks me so much. But the question of whether it is worth getting into that conversation in the moment is like, sometimes it's just not, because it's just too, I don't know. And maybe, you know, whether or not if you think that person might get it if you explain it to them. But anyway, it's an awful thing to say. That's all I have to say about that.
It's very dismissive and minimizing indeed, right? And, you know, for someone without the lived experience, and even again, for someone with the diagnosis of cancer, you know, that still looks different for everybody. But the recognition that, you know, you're not entitled to what you're thinking or feeling is so dismissive and minimizing and harmful. So even when I talked about boundaries, some of those boundaries mean stepping back from people who are unsupportive or judgmental. And that, I mean, that can be another loss. But like Aviva said, you know, what conversations do you want to expend your energy on? Some people, you know, you might be able to educate. Others, you might not want to waste your time and energy. I think it just speaks to another, you know, range of philosophical barriers or boundaries when you have to care for yourself moving forward, and absolutely acknowledging the frustration or hurt or sadness or resentment that comes with that, because you're not alone in that. And when I mentioned gratitude, it certainly was not to dismiss or minimize any of this at all. But as you move forward, how you find those small moments, those tiny moments, again, to connect with who and what matters most to you, not to dismiss or minimize all the tough stuff, because it's acknowledging and honoring that too. But moving forward for you it's going to look unique for you, but it's certainly not supported by people who judge your experience. It's not their place.
Thank you so much. And thank you so much, Elizabeth and Aviva. Your experience, your knowledge, your perspectives on this really important topic are so valuable. And I think it was very much needed. We received a ton of really great comments about today's webcast, and I will definitely share those with you afterwards. So those of you who did leave your really nice comments, rest assured I will be sharing those. So I very much appreciate it. So thank you so much to the both of you, and thank you everyone for all your questions. Before we log off today, I would like to take a moment to thank our sponsor, CIBC, for making today's webcast possible. Thank you so much. I'd also like to remind everyone to not hesitate to contact the LLSC if you need more information or support of any kind. You can reach out by email at canadainfo@lls.org. Also, make sure to check out our website regularly for the dates of any upcoming webcasts or to watch all past webcasts as well. This one is also going to be recorded, so will be available on our website shortly. Please note that a short survey will be sent out to all participants after this webcast. We would greatly appreciate you taking a moment to fill it in, as it would really help us to offer you the most valuable information in the near future. So thank you again, Elizabeth and Aviva, and thank you to everyone for joining us today. Have a wonderful day.